Wonderful. Great. Guys, you're welcome. It's Josephine Greatness on Josephine Greatness TV. If you just joined in, you are most welcome. On YouTube, on TikTok, you are most welcome. Today, we are going to talk about the step by step guide how nurses, midwives, public health nurses can get to write your NCLEX as quickly as possible and as affordable as possible. So, if you just joined in, you are welcome. Please stay tuned. Great. So I've got a guest here with me. She is Tilly Young, an NCLEX consultant who is going to go through this with me. So Tilly. Oh, Tilly is trying to join the guest seat. She's still connecting. So those on YouTube, if you just joined in, you can share it. You can share the live session. If you're on TikTok and you are sharing the live, you are tapping your screen. Thank you so much. It will help people to get notified that we have started. People will get notified that we've started. So keep doing what you are doing. Those who are following my account, I am grateful. Mano Yobo, I see you are here. It's great to have you. Mano, do you want to join the guest seat? Do you want to join the guest seat? Tilly.
Yeah. Hello.
Hi, you are welcome.
Thank you.
Wonderful. Why? What was happening? Was it network?
I think I switched to WhatsApp, so I think that was what was not connecting me.
Oh, okay. Amazing. It's good to have you here. So I was just telling everybody here today that we've got you and you are going to talk to us through, you are going to go through with us how public health nurses, how midwives, how nurses can easily go through the NCLEX process. Yeah, and in my teaser video, I mentioned that there is a way people can get to write their NCLEX even whilst they wait for their license in their home countries. How if even if they've not yet written their IELTS exam, they can still write the NCLEX. So thank you so much for joining us this evening. I hope you are doing okay, Tilly.
Yeah, please, I'm fine. Yeah.
Good. If you are in a good place and you don't mind, can you pop your camera on? If you are okay to do so, anyway.
The network isn't so good here, so
okay,
it wouldn't help. Yeah.
Okay.
If this one is okay, then let's manage with this.
Okay, that's fine. Great. So as usual, guys, if you've got any question at any point in the live session, you can pop it in the comment section. And if you want to join the guest seat to ask your questions to, you are free to do so. As usual, as I do when I invite guests onto my live sessions, we go through questions. I ask them questions, they answer me. And then after that, we go into the general question and answer session before ending the live. So if you got any question, you can pop it in the comment section. And as we go through the questions with the guest, I'll be coming back into the comment section to answer, so we can answer your questions from there as well. I hope that sounds like a plan. Tilly's live is paused. Great.
It keeps pausing your own. I don't know why.
Yeah, I was coming on to WhatsApp to check on you because your live post. Okay, so let's go straight into the questions we've got for you today. So Tilly, can you briefly introduce yourself and your experience with the NCLEX?
Okay. So I am Tilly Young. My name is Matilda Osai. Yes, my brand name is Tilly Young. Yes, so I am the founder of NCLEX Pro Solutions, and we've been in existence since 2022.
Wonderful.
Yeah, helping people who want to actually go through the NCLEX registration process. Yeah.
Wow, I'm going to give you a clap for that. So since 2022, that's 3 years now, you've been helping people through their NCLEX exam.
Yes.
Amazing. So what inspired you to start helping nurses, midwives, healthcare professionals prepare for their NCLEX?
Okay, so actually, those times, like those years, 2021, 2022, when we made up our mind to do the NCLEX, I think it was solely about agencies helping people.
Okay.
It was few people that knew that they could actually also do it on their own. I remember I even had one lady when I tried to sponsor myself to do it, because those times hardly would you see somebody who was sponsoring themselves. We all thought that before you can write an NCLEX, you need to get an agency.
Yeah.
Some were saying it's very expensive, that you need somebody to take you to, you can't. So then I came into the picture. In fact, before I would do it on my own, I also started just like many other people. I messaged agencies, and unfortunately, some of the emails I got feedback was just after passing it before I realized that they even go back to me. But I think along the line, I read research about it, met people, and I realized that I could do it on my own without waiting for an agency. So then I started, and I also asked, check the registrations, the cost, and all that. And then I started for myself. When I did, then I started to tell other people about it, because I realized that some people have message agencies and they were waiting for them to return to them. Somewhere even like maybe they are having they are starting their educations after their diploma, but the agency will tell them that let's say you have to finish the school first, where you are working is not approved, or the required hospital and all that. So I realized there were a lot of people who were stuck. So I started telling people about it. And when I said, I think that was 2021, I was actually doing it for people for free.
Okay.
Yeah, I was doing it for people for free. So when you finish for somebody, and this will give you like some 100 cedis or 50 cedis for data or something. Yeah, but I think when I was coming to write the exam, which was 2022, then I was like, I was getting to be serious, but because of study, I couldn't really give time to it. But when I finished, the numbers like increased, kakra. So since somebody would come to me and would want it, and I needed to also be committed to it.
Yes.
I decided,
because it was taking your time, wasn't it?
Exactly. So take something, a token, which will get me committed to it, and then also get the people committed to it. Then I came up with the idea that, so I have a price. When you contact me, so you are going to do and all that. Yeah.
Oh, okay. So I've got prepared questions for you, but when you were talking about what inspired you to start helping people with the test, you mentioned previously it was the notion was that you needed to get an agency. So basically, what were these agencies doing? Were they preparing, like teaching, or were they helping you register for it? What exactly were they doing?
Okay, so with the agencies, each agency and then their contract, I'm putting everything together. So most of them, they are sponsoring you. So they are sponsoring you to write the exam. So they will take the costs for the NCLEX, and then yours to study and go and write. Some of them would ask you to pay an amount, let's say half of the cost, or let's say like $200, $500, depending on their contract with you. So, but the bottom line is they are supporting you to go through the process, because they will have control over you. They will tell you what to do and all that, because of course they are sponsoring you to write the exams. That's what they were doing for the people.
Okay. So when you say sponsoring, they are paying for the test fee and all of that. That was what they were doing.
Yes.
Okay. Wonderful. Till you are muted. So how long does it typically take from starting the process to sitting the test itself? You are muted, Tilly. I can see there are some questions in the comment section. No worries, we'll be coming intermittently into the comment section to answer. So those on YouTube, if you've also got any question, you can pop it in the comment section, and we'll be looking into that. SAF, thanks for the hat me. I've seen you've got questions in the comment section. Just give us some time. We are going to go into the comment section very soon. Yeah, Tilly. So I was asking, how long does it typically take from starting the process to sitting the NCLEX itself?
Okay, so with the process, a lot of factors come into play, because when you start the process and all things being equal, within a month or two, you should have your ATT. However, finances play a role. Those that will be issuing the credential, that's your nursing body and your school, also play a role. So basically, for those that are in Ghana, for example, NMC sometimes delay. They will give you like 2 months, like within 2 months before they will send it the school to. So basically, when you start, so you get your ATT, you can give yourself like
this one there. Let me not cut you in. There may be somebody who doesn't know anything at all about NCLEX. So when you say ATT, what does it mean?
Yes, sorry. Okay, so the ATT is the authorization test. After you have gone through the credential evaluation and you have registered with the board, they will give you the authorization test, like a passport to let you know that, okay, so you've gone through your credentials, you have registered with the board, and we are giving you that approval to sit for the exams.
Okay.
That is what the ATT means.
Thank you.
So from the time you start till you get your the authorized, it's long, so the short form really helps.
Yeah, just use the ATT. I just wanted you to mention it so that somebody will understand what it is.
Yeah, one training, yeah. So from the time you started, the time you get your ATT, you can give yourself like 3 months, 4 months. Yeah.
Okay.
For that, yes.
Wonderful. So you were saying you were trying to go through the process with, how to get your credentials put together. And can you give a summary of that? Till what goes into getting the ATT?
Okay, so before you get your ATT, you didn't school in the United States.
Mm-hmm.
So the NCLEX actually is for people who are in the US or New Zealand or Australia, but they are given opportunity for international nurses to also apply.
Mm-hmm.
So before you would apply, it's okay, you schooled in your home country, but they will have to make sure that your school background, your license is equal to that of the United States.
Mm-hmm.
So they will do something called the credential evaluation, meaning they are going to evaluate your transcripts, your license, and all that. Okay, so that one is the first step, the credential evaluation. Ajua. So after that one, then they'll give you a form for the NMC, and then that's your nursing body, your local nursing body, and your local nursing school. So that they will send it to the requesting credential body directly. So you present it to them. When they are done, they will send it to them, via whosoever medium, whether they are sending via courier, they are doing it email, or they are doing it via online portal. So when that one is done, then you can register with the board of nursing, and then you pay. So after that one, then some of the boards you have to do fingerprinting, others you don't do.
Okay. When
the board approves, your registration and the credential body, they also receive the report from the credential body. You have a couple of the credential bodies. CGFN is an example. When they receive the credential report from them, then the board can give you the go-ahead to register for the ATT. So when you register for the ATT, that is what I spoke about with PSCV.
Yeah.
The NCSBN is the one in charge. Then they will give you the authorization test. So from there, then you can book your test and then write the exams.
Wonderful. So many people think that NCLEX is too expensive. So how can someone realistically start with less than 3,000 Ghana cedis, for example? If those who are in Ghana, let's not limit it to Ghana cedis. Generally, how can people start with what they have, the less money that they have?
Okay, great. So with the NCLEX, I think when you put all the money together, it might be expensive. But when you break it together, because you don't need all the money. So let's say when we are going to recently we launched the program, I'll talk about it.
Yeah,
that's what you can start with the 30,000. But the normal process that you need to register with the credential body, like the CGFMS, the total cost for the registration process is around $1,000.
$1,000. Wow.
And then with $1,000, you don't need all at a goal. So when you start, you create an account with the credential body. Then you pay for the CGFNS is $485.
Okay.
So when you are done with the profile and everything, we do the submission. Then you pay that amount. After paying that amount, then they will give you the form. Okay. So getting that money, let's say we normally tell people that you don't have to have all the money, as I said. You can do it on a monthly basis, of which we do access for us and how you would want them to go about it. So let's say this month you've gotten the first one. Next month you can prepare towards, let's say, the board application. And then the board application, it's ranges from, let's say, $147 to $205.
Wow.
So you can, within the next month, let's say this month you've done your credential evaluation, within the next month, you can plan for that and get it done. Then afterwards, this one is for somebody who's not having the money down.
So this is basically doing it one step at a time.
Exactly.
And not waiting to get the bulk of the money. So it's from one step to another. So you gather money for the first step, pay for it, get it done. Whilst that is in the process, you are gathering for the next stage, right?
Exactly.
Wonderful. So, this is a step-by-step thing, but the figures you are mentioning are quite, not too little. You get it?
Yeah.
So what if somebody has gathered money for the first step, gotten it done? Is there a deadline from moving from step 1 to step 2? Because the person would have to, start gathering towards step 2. How does it, the whole picture look like?
Okay. So when you do the first step, you have up to 12 months to get all your credentials. Let's say the requesting body would give you up to 12 months to present all the documents to them.
Okay.
Now, when you get all the documents to them, like the document they requesting from your school and your nursing body, when you get it to them, then they will issue your CES. That's the Credential Evaluation Service Report. That one too takes 1 year to expire. So within that period, it means that you should register with the board and then possibly go ahead with your OTT.
Okay. Wonderful. Please give me a minute.
Okay.
Amazing. So I can see there are some questions about community, public health nurses and all of that. We will get, so please stay tuned. Don't worry, we'll get there. So what are the key, anyway, you've mentioned the key costs, some of the key costs involved in this process. So you've mentioned from when you need to pop your documents and all of that, but can you please take us through that again? What are the key costs involved and how can applicants cut down on necessary expenses?
Okay, so the key cost, as I said, we are doing the credential evaluation, which is the $45. You are doing the board application up to $205. Then you are doing the fingerprinting up to $77.
Yep.
I'm saying up to because each board and then their costs.
Wow. So it's a range.
It's a range.
Yeah.
Each board and then their cost, yes. And then
guys, you should have something you are putting down all of that. A jotter or something can put down points. Great. Sorry. Go on, please.
Okay. So with the fingerprint, that's what we are looking at, up to $77. Then with the piercing view or the ACT application, it's fixed $200. Then when you are done, then you come and do the booking, the test booking. That's when you have your ACT. You do the test booking, which is $150 if you are in any part of the world except Europe. Because when you're writing in UK specifically, you pay a tax of $30, making it $180 for the scheduling.
Wow. So if you're in the UK, it's even more expensive.
Yes. I mean, because of the tax. Okay. I don't know why the tax, but most of the countries don't charge for the tax. Even those that write in the EU, they don't pay the tax. Yeah. So that is that for the
Tilly.
So
Tilly, people are asking. Somebody is asking to see your face. So, he was on YouTube. He was asking for your face. I was like, you should come to TikTok. He's come here and he's still asking that he can't see your face. Great. So sorry about that. You got to the tax $30 extra tax if the applicant is in Europe. Okay.
Yes. And then so yeah, that's for those that wouldn't be traveling like with flights to go and ride. So
true.
Because it is not written in Africa. You don't write in Ghana. You write in only two places. That's South Africa and Kenya.
Okay.
Yes, and then with a flight to, you are looking at, let's say, $700 to around $1,000 for the flight and accommodation. That range because normally with a flight, when you book ahead, and it is not normally when you book around this time, like summer, it's very expensive. But around those Christmas, festive seasons, it's really expensive. But when you book, let's say any other like non-eventful days, I like to get it cheaper because I think March, April, I booked for somebody and we got the flight to South Africa around $500, and I was surprised.
Wow.
Then recently, that was the least I saw. That's and then because the dollar too is down, it was very affordable. And then accommodation. So basically, you can buy it around $700 to $1,000 or $900 for the accommodation and then the flights. Yeah,
wonderful.
That's when you put all together, you are around $2,000.
Yeah. So all that Tilly is saying is that you don't need to get the bulk of this whole around $2,000 before you start your process. You can start. It starts around 400 or so. It comes then the next stage is 75. So it's a step-by-step thing. You get it, you do it, you continue saving towards the next step and all of that, and you will get there. Excuse me. So the NCLEX is an exam that is not only used for US, Australia, New Zealand as well, access for that. I'm sure there are other countries that requires NCLEX as one of their prerequisites for granting license to internationally educated healthcare professionals. So on my talk page, usually what I do is that when we are done discussing relocating to a particular country, I pop a post on there to let you know the estimated cost involved in relocating to that particular country. So please watch out for that. This is going to be the NCLEX exam estimate. If you were here with me when I was talking about Canada, Finland, New Zealand, Iceland, Bahamas, when you go on the page, you are going to get a post on that. So please look out for these estimations on my TikTok page. If you just joined in, we are talking about how to easily write your NCLEX. So some say the process is too long. How to get the authorization to test is quite long. But Tilly Young is here with me. She's an NCLEX consultant, and she is here to talk about her agency, how they are helping people to get the process done as quickly as possible. So if you're a nurse, you're a midwife, you are a public health nurse, please stay tuned. That is what we are talking about. And you can pop your questions in the comment section. So are there affordable online resources or study materials you can recommend to people?
Yes. But let me talk about, I think the 3,000 one, I didn't talk about it. So we launched a program where brought the cost down for those. It's just like the UK that you are going by road or let's say train, you are going to like train and fly them. One is cheaper and easy, and one is longer and it's more like expensive kakra. So with the 3,000, you are going with a specific board. So it means the board is the one going to do your credential evaluation for you. So it means you do the board application, and that one is a 3,000 or let's say $300 that we spoke about. So with that one, you for the cost of the process, budgeting around $600 for the NCLEX process instead of the 1,000 for the main process that you go through. I don't know if I'm making sense.
I'm a bit confused here.
Okay, so I'm saying that with the 3,000 that I spoke about, that I said I would talk about it. It's also one side of the process. So in all, you are doing the process to get the authorization to write the exams.
Okay. Yes.
One is the main one that I spoke about. That I said it's around $1,000.
Yeah.
But with the first one that this one that I'm talking about, you can start with as low as $300.
As low as $300. What your agency is doing now?
Is doing. Yes, you can start as low as $300.
Wow.
That way you are registered with a specific board already.
So hold on. If people are coming to you, they are looking at starting with around $300, but the usual process is around having like $1,000, right?
Yes. So
wow.
The usual process, how do I even go about this? So the usual process, like you have two main processes to get your
authorization to test. Yep.
The first one is what I'm talking about. And then there's this very route that you can use to get your ATT.
Yes.
And that is what I'm saying, that you can start with the $300.
Wonderful.
So with that one, you are registering with the board directly. Then when the board gives you the approval, they also evaluate your credential from the school. So when the board gives you the approval, then you go and apply for the ATT. So with that cost for that route to get the authorization to test or the ATT, the total you are looking at around $600. But the initial one is the $300 I spoke about. Okay,
so tell us more about what your agency is doing before we even continue with the other questions, so that if people are here, they know that people just tap on your profile to get in touch with you. So tell us what you guys are doing step by step. Your agency's name, where you are located, what you guys are doing to help people get their NCLEX authorization to test for NCLEX easily, quickly, and cheap, affordable. Let me know they use cheap, the word cheap, affordable.
Okay, so with us, we are facilitating the process for you. We are telling people that you don't have to wait for an agency.
What is your name? What is your agency's name?
Okay, so we are NCLEX Pro Solutions. The second account to this.
Yes.
NCLEX Pro Solutions. Yeah. So we facilitate the entire NCLEX registration process for you.
Good.
Because sometimes it can be cumbersome if you don't know the steps involved in the process. It might even be costly, because sometimes you go and do board application, you realize that this board is not even approved and all that. The requirements are, things that you can't get and all that. But since we have the expertise and the experience, we know which board to do. So actually we diagnose, we do consultation, we diagnose what would be best for you.
What will work for you. Wonderful.
Exactly. And then we take it from there. We advise you on what to do. When you give her your information and after the consultation, then we go ahead and start your registration process for you. When we need any other documents, we ask you. So basically with that, what you do is that you provide us with the information and then the money involved, and then we are done.
So when you say that the applicant provides you with the information, what information are they providing you with?
Okay, so the information they provide, their normal information, the school they attended, their names, their passports, normal information about
documents,
the person.
Their documents, their transcripts, etc., their certificates. So they just give you the information and then they go back. All they need to do is to learn, practice, and you take everything. Sure. Wow. And they can start with as little as $300.
Yes, I know.
Amazing. Good. So as part of what your agency does for people, do you give resources for learning? Do you have learning resources you give to your...
Yes, we do. As I'm talking to you, we have a platform that every day we post NCLEX questions.
Good.
People. Every day. We have, like, people come and answer. We also give supporting materials, very good materials to help you. Yeah.
And so it's all included in the fee, the initial fee.
Exactly. All included in the fee. Yeah.
Okay. Amazing. That's wonderful. So since you started when did you start this faster process? Did it start in 2022 or it's a recent development?
No. Okay, so this very program, I think our first people that we did for was last year, December.
Okay.
Yeah, so we fully launched it this year, January.
Wonderful. So since you started this easier, faster route, how many people have received their ATT?
Oh, there are several of them.
Wow.
I think, yeah, we are in August. July, we had about 5 people writing in July.
Wonderful.
Yeah.
So that's it's a sure route. It's a sure route. And some have some written the NCLEX already.
That's why I said last month we had 5 people who wrote in July with just our
faster route.
Yeah.
Wonderful. So let's move on to MOH clearance when it comes to Ghanaians, or clearance from your Ministry of Health in whatever country you are. What does MOH clearance mean, and why is it usually required in the NCLEX process?
Okay, so with the MOH clearance, it's not really needed per se.
Okay.
But then, if you need to do credential with the nursing board, then your home country. So let's say the Nigerians, with them you have to work for 2 years before the nursing board would give you credential. Verify your credentials for you. Okay, so with that one, it is country specific.
Okay.
Now it is mainly with the nursing board, okay, or the government. So with the clearance is like, let's say the government sponsored you to do your nursing.
Yeah.
So they expect that you are working, or let's say you schooled. You have to make sure that any cost the government incurred throughout your training or whatsoever, you should fulfill, or you shouldn't have any debts with the government. That's what the clearance actually means. Okay. So just as we are in school, when we are coming to complete, they'll give you a form, like a clearance form to clear yourself. You go to your department and all that. It's the same thing too with the Ministry of Health. So they will let you take it to your workplace to make sure that they sign and probably make sure that you don't owe the hospital or
the ministry.
You are not on the study leave or whatsoever. Yes, then you take it to your school too, your nursing school. Then when they sign for you, then you submit it back to the nursing, the MOH, that's the Ministry of Health, for them to officially clear you. When they are done, I'm taking into an account what happens in Ghana. So when the Ministry of Health is done, then they will send it to the NMC. So because you don't have any business with the MOH, but because you want to verify your credentials with the NMC, it becomes a requirement. However, if you attended a public university, like University of Ghana or any other university, or you attended a private nursing school, you don't need the clearance.
A private, because that means that the government didn't spend on you.
And the university too, it means that the government didn't spend.
Okay. So that means that those who didn't go through public institutions like training colleges or the public universities, they don't need MOH clearance. They can go straight into the process without the step. But if if the government sponsored your education, then you need to go through the MOH clearance.
Exactly, mainly for those that attended public nursing training colleges, the colleges.
Okay.
Because I think in previous years, when you go to the school, they will let you sign bond. I mean, for 5 years.
Yeah, the bond.
But so that was what was the clearance. So meaning that with that period, you have to make sure that you have, finished your 5 years before you want to travel. And if the 5 years is not up and you want to clear yourself, it means that you have to have an amount to pay.
Yeah.
So that was what was about the clearance. That's why the universities and then the private nursing schools are not part, because they don't sign any bond.
Yeah.
But it's still now the bond is no more there, because the government says you are not entitled to work automatically with the government. You can travel, but still it is still there that once you attended a public training college, you have to clear yourself. That's
whether the government spends on you or not, you still have to clear yourself.
For the spending, the government is still spending on them. For the spending, because when you go to the training colleges, it's assumed that your part of your training, the government is the one providing.
Okay. So
yes.
I want.
It is the bond that is no more there. The bond that would require you to work for a specific number of years before you travel. That is what is no more there.
Okay, so currently there is nothing like a minimum of 5 years work experience in the country before leaving.
No,
this is Ghanaians. Like okay, yes. But then if since it's no more there, if you've worked in the country for 10 years and you are leaving, are they going to still tell you to pay something, even though the bond? You see, do you get where I'm coming from?
I get it, but even now, if you don't even work and you want to clear yourself, you don't pay anything.
Oh, okay. Wow, that's a great development.
Yes, you don't pay anything because you didn't sign any bond. So if let's say you completed school, you went to nursing training college, you completed today, and you want clearance, you're supposed to give you the clearance because you didn't sign any bond.
You didn't sign a bond. Wonderful. So those who attended public universities, right? I don't know if this question is going to be relevant. How can someone bypass the clearance stage? Is there any way somebody can bypass the clearance step legally and still register for their NCLEX?
Okay, so yes, if you attended a public training college, you still want to write the exams. As I said, you will need a clearance. But this very program that I brought, you wouldn't need the clearance. Because you can write without verifying your license. You can get the ATT, that's the authorization to test, without verifying your license. So it means that you can bypass the clearance. So normally what we tell people is that you can start because with the NCLEX, we use, when it comes to the USA, you use the NCLEX to file for you. So let's say if I write today and you write next month, and I guess somebody will file for me since I'll be ahead of you. It is like first come, first out protocol. So normally we tell people not to delay with the clearance. Once your clearance is like you have issues with it, because it sometimes takes long for the clearance to be signed and all that. But if you are ready and you want to start the process, then you can start the process, get your ATT whilst you are working on your clearance. Then because you can use the clearance to do your visa screen. With the visa screen, you will need to verify your license first. So we tell people that start the process. If you need to provide clearance, then you can go through the process. The process that you wouldn't need the clearance first. When you get your ATs, then you write the exams. You get an agency, they won't ask you the route that you used to get your license. Then very important thing is you have the license. They will file for you. Then you work on the clearance for the visa screen.
So, in summary, the clearance is not a foundational requirement for getting your ATT, but then it is definitely needed in the process of, going over to the US. So you can get your ATT, write your NCLEX, whilst your clearance process is also ongoing. So it can be done simultaneously, right?
Exactly, yeah.
Amazing. So, I was going to ask, are there risks or disadvantages of writing the NCLEX without MOH clearance? And from your previous answer, what you just said, it can delay some part of the process if you haven't yet gotten it.
Your question again.
Yes, I was asking, are there risks or disadvantages to writing the NCLEX without getting the MOH clearance first?
Okay, so
okay, I can see some questions. Okay, Tilly, you are here. Yeah, you paused. You went off for a while.
It was my battery that reminded me.
Mm-hmm. Yeah. Please charge your battery for us. So.
I was saying that yes. So if you are waiting, because you would need to verify your credentials with let's say the nursing body. But with that one, if you are going through that route that I just spoke about, you really need a clearance at the beginning. So as you are waiting for example, this year I had like people that they needed a clearance, but when I introduced them to the program, I think we had most of them writing last month, July. While some people are still there waiting for the clearance, they also contacted us around the same time, but they don't have the clearance yet, so they are still stuck. So there's people that have written with the agency or employers who will file for them, and they will be ahead of you.
Yeah, people sitting down waiting for clearance before you write your NCLEX.
Exactly. So that is only the only thing is, let's say, when you are there, you still need a clearance, which of course we tell them that. So you start the clearance process to like alongside simultaneously. So by the time your clearance is ready, you are also
your NCLEX is ready. Wonderful.
Good. Then
that's a smart move. It's a smart move. So you do two things at the same time, and it's possible by the time you've passed the NCLEX, clearance 2 is done. You move to the next stage.
Exactly.
Wonderful. This part of the questions is what people have been asking for. I've seen most questions in the comment section about this. Can midwives and public health nurses take the NCLEX directly, or are there extra steps they need to take? And somebody also just popped in the comment section if she can start the process while she's still studying as a student healthcare professional.
Okay, so with midwives and community health nurse, they can all write the exams. Okay, but then the issue is that it is about your transcripts, mainly your transcripts. And with the hours, mostly when you do the diploma in community, diploma in midwifery, their hours don't really match up to. So that when they are doing the credential evaluation, mainly they are looking at whether your what you studied here is equal to the RMB, the basic RN standard for the US. Less. And you see, in our case, because it's a specialty, the schools tend to focus more on those areas, neglecting the general
nursing aspect. Yes.
Not like they really neglect, but they do. But the hours are not so much sufficient. So they have range. So let's say MedSearch, they would require you to have a specific hours that you studied it, both theoretical and clinical. So when you see the report for the RGN and then the community or the diploma, you will see that the hours for those general courses like the medical nursing, surgical nursing, pediatric nursing are lower.
Yeah.
Okay, so that's what brings the difference. So, but when you do degree, with a degree, most of the schools have, like, let's say they will do message 1 and 2.
Yeah.
First year, second, like first semester, and that one would probably, like, it will increase the hours. So we tell people that, of course, a lot of things come into play when it comes to getting you, like, getting the ATT for you.
Mm-hmm.
You see, some of the schools, they've done it, so they know. Okay, so they will tell you that, okay, so they would even go ahead and then provide the requesting authority with the right information. I mean, so let's say message, you know that the minimum for message for you to be approved is, like, let's say 140.
Yeah.
They can give it to you.
Okay.
While some schools will be strict.
Mm-hmm.
Some of the the evaluators would also, it's human beings that are going to evaluate you at the end of the day.
Mm-hmm.
When it gets to them.
Yeah.
Some of them, they are human beings, so it's like a range. So let's say medical nurse, and we are looking at, let's say, their approved hours would be, like, let's say 140 to 150 hours. That's what the credential body accepts.
Mm-hmm.
Some of the people, when, let's say, your school has written 139 for you or 137 for you for, let's say, medical nursing.
Mm-hmm.
Me as an evaluator might say, oh, okay, so I think this one is closer. 139 and 140 is closer. So let me just approve this person.
Okay.
But somebody will be strict and say, I will give it to you.
Okay, so it depends on who is evaluating your credentials.
Exactly. And what your school also fits them with. But we tell people that, of course, a diploma can write. I've done it for diploma midwife.
Yeah, because I've been here on a live session, guys. If you're a midwife and you are torn between whether you are able to move to US to practice, I've been here on a live session with a midwife who has gone through the process. Thank you so much, Joe Paddy. Thanks for the roses. And those who are following, thank you. Those who are liking, KLB, I see you are tapping your screen. Thank you so much. The new followers, thank you as well. Those who are sharing it, bless you. So I was here on a live session with RM Adepa, who is a midwife, and she's gone through the US route, and she's currently holding her license with US. She's a midwife. So please, if you missed that session, go on to my YouTube channel. My channel name is Just Greatness TV, just as you see up there for my TikTok page. Just add TV to it on YouTube, or the shortcut is my channel link is available in my TikTok bio. So click on it and go there. You can, watch that video. It will help you a lot. She went through the step-by-step guide, how she did it to get a license with the US as a midwife. So yes, if you are asking if midwives can also write the NCLEX, yes, you can. Basically, NCLEX is not only for US. If it's US you are looking at, yes, you can. But then Australia, New Zealand as well request for NCLEX at a point. So yeah, Tilly, your life is paused. And what Tilly was saying here is that if you're a midwife or public health nurse, yes, she's done it for a diploma midwife before. Public health nurses, I'll ask her more questions on that. But from what she's saying in summary, if you have done a degree in midwifery, it's easier. Even though the midwife I interviewed here used her diploma midwifery, she also recommended that if you have a degree in midwifery, it's more easier than just using the diploma. Yeah. So Tilly, you were talking about midwives and public health nurses.
Yes. So as I was saying, I have done it for diploma midwives, and they've been successful. Okay, but it is money that is involved.
Okay.
And we know our parts of the world. So if you don't mind trying, of course we can do it for you. And even the main thing is a visa screen. Mostly with the visa screen, some of the evaluators that you can go through after passing the you can go through as a midwife, like ERES. They don't have the visa screen.
Okay.
So they can give you the approval with the board to get the ATT to take the NCLEX. But when you are done, you have to go to a different evaluator. CGFNS or GSA to get the visa screen, which might be a problem.
So basically, you are saying that for midwives, ERES is for them, but then they don't have credential evaluation. So you definitely have to go back to another board to do it for you, and that's where the issue may come out. Okay.
Yeah.
So throw more light on that. So what about public health nurses? Is it the same thing for them?
It's the same thing. Public health, psychiatry, those specialties is the same thing.
Wow. Have you tried it for public health nurses or psychiatry nurses before?
Okay, so with the public health nurse, I asked her to do it because I didn't want to. But I gave her the guidelines and everything. I spoke to the school and she had it. But I told her that honestly, I wouldn't want to commit because I had not done it for any.
You've not tried it before. So she has gone through the process and she's gotten her ATT.
Yeah, she got the ATT.
Wow.
I think it was either February or March that she contacted me. I really forgot it. But she has gotten her ATT. She used Eris. I sent her the link. I went through her profile when she was done and everything.
Wow.
She has gotten the ATPT.
Yeah. Wonderful. So that answers the question. Someone was asking, can public health nurses also write the NCLEX? It's a yes. You can write the NCLEX. What about somebody who is currently in school?
Okay, so if you are in school, mostly your school will be willing to give you a transcript when you are done, when you have completed. Vesta of Ghana used to send transcripts, when you request, but now most of the schools I know, and it makes sense. They need to give you a complete courses.
Yeah, they need to be sure you are done.
Also wants your complete courses. So mostly when you are done, so if you are in your final year or something, or your final semester, then you can start the process for you, and give a request to the school. So once your transcript is ready, then they can issue.
Okay, so that means that while you are still in school, some universities may be happy to give you the transcript, but some too, if you are in your final semester, that one they know that for sure you are almost done with it. Some are happy to give the transcript.
No, so most of the schools, I said, University of Ghana used to give like your transcript when you are in school, but now University of Ghana, I know, is no more issuing transcripts.
It's not issuing transcripts again.
Yes, they will tell you that they only give it to you when you are
done with the school. Okay.
And then also the evaluators would want a full transcript covering all the courses. So it makes sense that the schools here would want you to have complete your school before they issue a transcript.
Yeah.
So when you are in the school and you want to still start the process, maybe you can consider it when you are in your final year.
So when the process starts, by the time you are done with that semester, you would have gotten your transcript, right?
Exactly. Yeah.
So that means starting the process is not really about having your PIN, your license in your home country. It's about completing your course. So if somebody has completed the school, but then they've not yet received their license, can you talk about that? Can they get the NCLEX done whilst they wait for their license?
Oh, yes. So that was the program I spoke to you about. So with that one, because we are not going to do evaluation with your nursing body, you only need a clearance. You're only going to use the transcripts. So if you have completed the school, you don't have any issue with the school can issue a transcript and your license is not ready, you can go through it. If you are doing rotation, your license is not ready, you can go through it. If you just complete the school can issue a transcript, but your license is not ready. You really need the license now, so you can go through the process.
Wow. Previously I thought people need to get their license before they start the process. But here you've clarified that the main thing is you are done with your school. You don't need the license before starting the NCLEX. There are some questions here. Emerald says, I think I saw Tina Asantua says, can a midwife take the NCLEX exam related to midwifery? I haven't seen an NCLEX questions that are just for midwifery. It's Tilly, please answer that question for us.
Okay, so in the United States, every specialty, as a nurse, you have to start from the basic, like a registered nurse.
Mhm.
The exams is for like whether you're a midwife, you want to write the NCLEX, a public health nurse, you all write the NCLEX RN, which is like a general nursing exams.
Mhm.
Yes, so you don't have exams
Midwifery.
specifically for midwife, as you rightly said.
Exactly. And Abigail says she said visa screen is a problem when it comes to midwives. What do we do then, please?
Okay, so I think Abigail didn't get her initial thing.
Yeah.
So we are saying that when you have the degree, going through the getting your visa screen, it's made getting the visa screen so much easier.
Mm-hmm.
Virtual. It makes the getting the visa screen easier. So if you have the diploma and you still want to go through the process, you can write it, but you can also think about upgrading to get the degree. And I think I made a video about a school that is doing 12 months and 18 months for BSc midwifery, a sandwich program actually, BSc midwifery and BSc nursing respectively. Maybe Abigail, it can benefit you. So
where are these schools located?
So it is in Offenso, South.
It's in Ghana, West Africa.
It's Patrick Nursing Training College. Yeah.
Oh, okay. So are you recommending that, let's say for example, I'm a diploma midwife, I can start the process of getting my ATT whilst I'm still pursuing my degree in midwifery? Is that what you are saying?
Yes, exactly. You can do that.
Wow. Okay. But from the beginning, you mentioned that when you start the process, you have up to 12 months to complete everything. Do you get what I mean? So if I'm starting everything and I've got only 12 months to finish everything, what if I'm not done with my degree education within that 12 months? What happens to me?
Oh, no. So that one is specifically for, so it's like a service. So you are going to do your CE, like a credential evaluation service. And that credential evaluation service is you will be given 1 year period to submit all the credentials.
Okay.
To them. When you are done with that one and you are facing the NCLEX, then you will get the visa screen too. That one too is a different service that you will need to purchase.
Okay.
So
wonderful.
All don't happen within that 1 year. Each service and then the period that you'll be given to provide the credentials for it. Yeah.
Amazing. So Riam 1923 says, what about midwife? I don't really get that question, but maybe are you asking if midwives can write the NCLEX? It is yes. And it's easier. As Abigail asked, it's easier if it's a degree in midwifery. But Tilly has mentioned that you can still start the process, get your NCLEX done, and then you can, whilst you further your education into degree. But then I'll recommend that you guys should watch, if you're a midwife, you should watch that live replay. It's available on my YouTube channel. It's a midwife who is a diploma midwife who has gone through the process successfully. You need to watch that video to catch how she went about his stuff. And okay, we've answered that question. Tilly, I'm going through the comment section. Emerald says, what about enrolled nurse who has also done the degree?
Oh, beautiful. So if you're a enrolled nurse and you've done your degree, you are done with the degree, you can start the process. These are the people that we are looking for.
Degree
you can start the process. Yes. Get the ACT. Then you're on your way to the United States. Yeah.
Wonderful. So this one, if somebody who is a novice, a student, doesn't know anything about this whole relocation stuff. So the NCLEX, I know Australia, New Zealand, and US uses the NCLEX. Are there any other countries that access for NCLEX? You are muted, Tilly.
Okay, yeah. So those 4 countries, the United States, Canada, Australia, and New Zealand.
Canada. Wonderful.
NCLEX.
Yes. So it's the very same NCLEX. So if somebody is here, is a midwife, and is thinking about the NCLEX, can I not write it? Even if the US is difficult to get there as a midwife, you should know that you can use it for other countries like Australia. Mia says, is it possible to get a link or study material for NCLEX?
Of course, yes. So please send me a DM. I would send you my WhatsApp number. Mostly I share them. It's easy to share them on WhatsApp. So I'll give you my WhatsApp number. You message me and I'll send you the materials through there.
Great. Guys, if you are here and you are looking for a quicker route in getting your ATT to write your NCLEX, make sure you are getting in touch, you are connecting with Tilly Young, NCLEX consultant, or that's their agency account in the guest seat, NCLEX Pro Solutions. Make sure you are getting in touch with them. They will help you through it. You can get things done quickly and more affordable. As you heard, she mentioned, if you just joined in, she mentioned as normal, the amount people may need to start is about $1,000. But then they have brought up a route that you can use as less as $300 to start. Abigail says, I have a degree in midwifery. Oh, okay, thank you. You're welcome, Abigail. So it will make it easier for you. Great. So the name of the midwifery school, the school that is offering the 12 months top-up degree course, is in the comment section. St. Patrick's Midwifery School in Offenso, Ghana, West Africa. And I'm just trying so that we can answer some of the questions. What about diploma? Rhyme 1923. I'm not too sure what exactly you are talking about when you talk about what about diploma. So for midwives, I've mentioned that I was here on a live session with a diploma midwife who has gone through the process. So please watch that replays on my YouTube channel. My channel link is in my TikTok bio. Click it and watch it. You can find it in the relocation or migration playlist, or you can find it in the live session of my YouTube channel. And Tilly Young here has recommended that if you're a midwife, yes, you can, but it's more easier if you are a degree midwife. And she's mentioned that it's the same with public health nurses. You can with your diploma, but it's more easier if you've topped up to a degree certificate. Tilly, am I correct? Am I right? You are muted.
Yes, you are very right, sis.
Wonderful. Emerald is saying, I was enrolled nurse, but I have done the degree, but waiting for my NMC results. Do I need clearance?
So the clearance, as I mentioned earlier, will depend on the school that you attended. Whether that's a basic school for the enrolled nurse or the hack.
Mm-hmm.
If it is a public training college, she will need it. If it is not, she wouldn't need it. Mostly, they don't look at the top up that you did. Yeah, but she can also start the process, as I said.
Yes.
She wouldn't need the clearance from the beginning. She can start the process.
So, in summary, she shouldn't see the clearance as the first step. Even if she needs a clearance, the first step is not the clearance. So she can start heading towards getting her ATT and as well getting the clearance while she's going through that. Ibrahim Lanza says, what about a public health nurse? I think we've answered this and answered it all over again, isn't it? Maybe he joined in late. Can you please go through the public health nurses again for him? You are muted, Tilly.
Okay. So, yes, I said just as the midwives, the public health nurse or the community health is also a specialty. So if you have the degree, it makes it easier to go through it.
Wonderful.
Yeah. But if you have the diploma and you still want to try it, you have to know that you're going to be like try and error. If you have the money, there's no problem. But mostly we consider Sikano.
Mm-hmm.
But if you still want to go through it, of course we can do that. Yeah.
Okay.
But you have to get your degree. That one, when you come, myself, I'll hold your hand to take you through.
Okay. So what I'm going to say is that Ibrahim Lanza, get in touch with Tilly Young, and their consult is offering a discount for people who are going to come from my side from this live session. So we are going to give you a discount code where you can get a discount with them when you get in touch with them. So please stay tuned for that. BTC and XAU says, I had 4-year experience. Can I take NCLEX? 4 years experience in what, please? Osei Tutu says WES is evaluating my BSN transcript. Can I use that to get my ATT?
Okay, so with the WES or WES, he has to check out the board that he or she is using, because not all the boards accept report from the WES. Apparently, it used to just be for the school, but now they expanded their services to include the license too. But still, not every state in the US accepts it. So he has to check, the states that they, approve or accept the CS report from the West before he can proceed.
Okay, I think your NCLEX Pro Solutions answered to him, to one of the, is it BTCs, and said yes. So okay, NCLEX Pro Solutions says Ibrahim needs degree public health nurse. If it's degree, he can. And as Tilly, you've mentioned, if you are holding diploma and you don't really mind to try and error with your money, you can try it and see if it will work. But then if it's degree, it's a sure thing that the possibility of you going through the process successfully is higher, way higher than the diploma. Mia says, thank you. I'll be glad. How can I get your contact? You just have to click on her profile and DM her. That's all that you need. So I think at this point we are not done yet, but let me just put the discount code out here. So the discount code, when you get in touch with NCLEX Pro Solutions or Tilly Young NCLEX Consultant, you can quote JOJ 2025. JOJ 2025. I'll pop that discount code in the replay of this live session on YouTube. So if you joined in late, don't worry. The replay of the live session will be available on my YouTube channel, and you get the discount code in the description section. So when you mention the discount code to NCLEX Pro Solutions or Tilly Young, you are going to get a discount. Tilly, what percentage discount are you giving to my people, to my community members?
Our service charge is $150, but with the code you are giving them $145.
Wow, so that's like is it a 5% or a 10% discount?
Yeah,
5%. That's wonderful. So guys, make sure you are using that JOJ 2025 to get your 5% discount from Tilly Young or NCLEX Pro Solutions. So Ibrahim says, what about diploma in public health nurse? And I think we've answered that already. Yeah, that's what NCLEX Pro Solutions has said. It's 50-50. You can try it, but it's 50-50. Nanayao says, I'm in Canada now. Can I think he's asking if he can go through the clearance process. He's currently in Canada.
So what does it mean if he can pass the
he wants to know if he can bypass it.
If
he can bypass. Oh, okay.
Oh no. So yes, he can if he wants to write the exams. He can go through it as I've said, but with the Canada, after the NCLEX, he would need to register with the province, and then the province would evaluate the license, like the local license here. So he will still need a clearance as if he attended a public nursing college.
Okay. I hope that answers your question, whoever asked that. Annette 515 says, what if you have RGN diploma and degree public health? Are you eligible?
Yes, so we will be using the diploma to do the evaluation for her.
Okay.
Since you said the diploma is in the RGN, yes, we will use the RGN.
So that means that for nurses, if it's diploma, it doesn't matter. So it is the specialties, that's public health nurses, psychiatry, midwives, who it's better they use the degree. But then if it's nursing,
if
it's a done deal.
Registered nursing or the general nursing, because I did it with my diploma. Yeah, so you can go through it. It is those specialties that you need a degree, because you will need the credit hours to go up, and with the degree, since it's like the years are more, you will have more years more credit hours for those expected courses.
The general ones. So with somebody who has got like Annette 515, can she use both? She has to choose one.
Oh, if the diploma is okay, if it was a degree, we'd have considered, but with the public health, there's going to be bias when it comes to the evaluation. But since the basic one is what we require, it should just be an extra cost to just use the public health. I don't know if you get it.
Yeah, I do.
Yeah.
I can see something TYVWF. I don't know what that means. If somebody knows that. Okay, yeah. So Annette 515 DM NCLEX Pro Solutions. All right. Sophie says, is there an age limitation? Because I heard Australia, Canada are somehow looking at that.
With Australia and Canada, unfortunately, I don't really know their age limits. But with the US, I know recently even there was a 60-year-old woman that had
Wow.
Yeah, she was going to practice.
A 60-year-old woman. That means that there is no age limit, is there?
Oh no. So when it comes to the US and their RN, well, I need to be there to see why. Because sometimes you see the news 50 years, 60 years, and they are rising the ankles, and you would be wondering what's actually practicing. Because you all know what nursing, being a nurse in Ghana is. I wouldn't venture even in my 40s to be in Ghana. But for that age, of course, yeah. So probably the only problem would be, let's say, an agency or the employer coming to sponsor your visa to the US. That's where I might see the challenge. But with so far, I don't think I've not seen any agency putting across age limit when it comes to, international nurses, yes.
Okay.
To the US. Yeah.
So, BSN Aaron's question is going to make me move on to my next question. She is asking, which board of nursing would you recommend for degree public health nurses? And I'll also add on, are there specific US states that are friendlier to midwives or public health nurses?
Yeah, so there are specific states for those specialties. We have like New Mexico, we have Illinois, we have I've mentioned New Mexico, Illinois. Yeah, I think those two are
friendlier for public health nurses and midwives, right?
Exactly, and psychiatry.
And psychiatry.
Parts, but I think from 2023 they started frustrating. I mean, it was a whole lot, so they are taking Texas out of my list. But it's Illinois, New Mexico. Yeah, it's kind of reliable.
Wonderful. So I don't know if NCLEX Pro Solutions can type these two boards or states in the comment section for psychiatric nurses, public health nurses, and midwives. Superb. Yeah. So Tina Asantua has popped the discount code, the JOJ in 2025. Yes, that's it. So if you are getting in touch with NCLEX Pro Solutions and you found them from this live session or from this page, using Greatness page, make sure you are quoting that code to them and you get a 5% discount. Okay, so Nanayao says, okay, yeah, NCLEX Pro Solutions says $5 discount. That's wonderful. So Nanayao says, I'm in Canada now. With Obapa, which board? Oh, okay. Which board of nursing would you recommend for diploma midwife in US? Is it the same too?
Yes, the same.
Okay. Nana, if you are a midwife, I think that the session I had with Aram Adipa will be also good. I'll recommend that replay to all the other specialties, psychiatry and public health. You should watch that replay. It will help you a lot. Because basically, in summary, what Tilly is saying pertains to midwives and public health nurses as well. Great. So let's move on with our questions. So, what extra documentation or training might be needed for these groups? Is that the easiest people who get it easy with this US route is nurses. When it comes to midwives and other specialties, it's quite some way. Do they need extra documents apart from what the nurses present?
Oh no, so it's the same thing. That's why we mainly say once you're a nurse or you're a specialty with a degree, I mean, you have all the documents because what you need is like your name, your date of birth, your school transcripts, your
Guys, if you just joined in, you're welcome. The topic on the screen is what we are discussing today. Those who are following, those who are tapping their screens, sharing the live, thank you so much. Our gifters, thank you so much. Yeah, Tilly, you were saying.
Yes, so I was saying that. So normally the bottom line is you being a nurse with either a diploma or a degree, or if you are a midwife, a psychiatry nurse, you have the degree. All the other documents will be like your name, your date of birth, your passport, your transcripts. Of course, you have to be in good standing with your school because they will be doing the evaluation. You have to also have good standing with your nursing board because they will also be doing the evaluation. And then probably your passport. There are mainly things that once you have gone through the school, you would have them. There are no extra.
There are no extra document for specialties. Wonderful. Now let's talk about writing the NCLEX without IELTS. How is it possible to write the NCLEX without taking the IELTS?
Okay, so when you go to the NCSB, and I mean the body that gives the authorization to test, actually the IELTS is not there. It's not part of their requirement.
It's not a requirement. Okay. Tilly is muted again.
So when you go through those, when you go to their website, the distance is not actually a requirement, but the IELTS is board specific. So we have certain boards that they require the IELTS. Okay. Some don't require. So it's just the board, part of the board. The thing that the board would want you to provide. That is why. So if you've not rated the IELTS and you would want to do it after the NCLEX, it's good you always go with a board that does not require the IELTS. Yes. For the IELTS you will need it, but mainly we use it for the visa screen.
The visa screen.
So for the NCLEX.
For the NCLEX. Okay. So which states or boards of nursing do not require IELTS for the initial registration stage?
Oh, there are a lot of them. I can't call out all of them, but we have Colorado, Texas, Illinois, New Mexico, Montana. They all don't require the IELTS.
Wonderful. Amazing. Yeah. So SAF or SAV is saying so there's no need for NMC PIN or license as requirement, right?
Yes. For the second program I spoke about, you don't need the NMC PIN. Yeah.
That's why you need to get in touch with NCLEX Pro Solutions, guys. They are going to make the process as easy and quickly as possible. If you were here from the beginning, NCLEX Pro Solutions mentioned all you need to do is to give them your documents, then go and study. They will handle everything for you. So I think this one is so could skipping IELTS affect your chances of getting a visa later in the process?
Okay, so I don't know what you mean by skipping, but you're actually not skipping the IELTS. For the IELTS, you will need it, and you will need it for the visa screen.
Okay, so come with me. There is no skipping IELTS. You definitely have to write it. Just that is not a requirement at the beginning stages of the whole process.
Yes. Okay. So when you're facing the NCLEX and you have passed, then you have to do a visa screen. A visa screen is like also eligibility for your visa to get your visa. Since you didn't, there are specific countries that when you schooled in, they are exempted for the IELTS, but most of the African countries are not exempted. So for the IELTS, you need it for the visa screen.
And so the reason why I asked this question is that the IELTS expires. So if from the beginning you wouldn't need the IELTS, then I think it's better to hold on a bit, get into the process to some point before you write it, to avoid it being getting expired before your visa screening stage. Do you get where I'm coming from?
Yes, I do get it. And of course, you can even wait when you are done with the NCLEX, then you write the IELTS. With that one, for the IELTS or the visa screen, the path is different from the visa. So like when you have passed the NCLEX, you can contact employers, get them. They would ask you if you have the IELTS and all that. So some of them will file for you and ask you to go and get the IELTS. Some of the few ones would ask you to write before they file for you. Depends on the employer. So when you get the IELTS together with the NCLEX that or then your license that you had, that's the NCLEX. Then you do the visa screen. The visa screen is like a document that you are presenting to prove that, oh, I've indeed passed the NCLEX and I have what it takes to work in the US as an international nurse. That's all what the visa screen is for.
Yes. Wonderful. So Mia is saying, I have 4 years diploma in midwifery and psychiatry, and I'm working as a renal sister for 7 years. What's the prospect?
Renal sister. And only a day here.
So I guess she's a kind of a ward manager, a renal ward manager. Mia, is that what it is?
And I think she's in the UK.
Mia, where are you? And SAF is saying, if you have an English proficiency letter from a university, can you replace the IELTS?
No. So they have a specific English proficiency, IELTS, OET, PTE. These are what they accept for you. But with the university on, please no. That one I don't know about it.
Okay, wonderful. And Mia says, can you please plug me how to apply as a renal sister? So the thing is, renal sister is the job role. The role is a renal sister. What certificate do you have? You've mentioned that you have a diploma certificate in midwifery and psychiatry. I don't think you've got a certificate as a renal sister. Do you get it? So those two certificates is what you are looking at. Either you are going to use if you are going to use the midwifery diploma certificate, or you are going to use the psychiatry certificate. All right. Renal sister, I think it's a job role. It's a job role. Great. So let's go through some questions about preparation and success tips. What is the best study plan for someone working full time whilst preparing for the IELTS test?
Okay, so the best study plan is to study every day, or study like 5 days in a week. Of course, we were all working when we did it. You can still do it, and then you can so you can we always actually have study plan for our people, and we have a tuition in the pipeline. So very soon we are going to offer the tuition as well. But with the study plan, what I can say is that you have to make sure that every day you are doing something related to NCLEX. You can give yourself like 4 months to study. Let's say if you are studying every day, even 2 hours every day, or you are solving like 50 questions every day. When you give yourself like 4 months, 5 months, you should be ready to write it. So let's say the days that you have duty, you can do 30, 40 questions.
So that's for a first time, a starter, somebody who hasn't written the NCLEX before.
Exactly. Okay. And days that you have what is the name? You have a class or you have work. You can do the 30 or 40. But days that you are off duty or something, you can do the 75 or 85 questions. So we also have a structured study plan as well that our clients are going to get. Yeah.
Araba Otu is saying, so you mentioned you guys, when they come to you, they'll get a study plan too.
Exactly.
So you are not leaving them to go learn on their own. You are helping them with that as well. That's amazing. Araba Otu says, then I should have done BSc in midwifery instead of nursing. Araba, why are you saying that? Why are you saying that? So, what are the most common mistakes that make candidates fail the exam? Okay, so about you have diploma in midwifery and you've done degree in nursing. That's great, isn't it, Tilly? So she can use the degree in nursing for this process, isn't it?
Yes. So if she's having, so she has a diploma in
Midwifery. Yes.
Oh, then she should come.
Yes.
Please come.
But degree in nursing, which is perfect.
It's very perfect.
It is perfect. Yeah.
Yes, very, very perfect. So if you didn't take the midwifery pathway, just come.
Yeah.
Okay. I learned, and now there are a lot of schools. The last time somebody was saying that she can't branch to general nursing with a diploma midwifery. But now there are a lot of schools. Calf University is having 3 years program for midwives to switch from the midwifery to nursing. So at your final year, you will write NCLEX. You write the RGN license. Yeah, to get the RGN license. Yeah, so there are a couple of schools. So let's say you can start with the diploma, then you progress to get your scores. But I think the fastest one would be the St. Patrick one that I spoke about, the 18 months and then the 12 months program. Yeah.
Okay. Wonderful. So I think have you answered my question on the common mistakes that people makes candidates fail?
So I think I didn't answer that before this one came. Okay, so with the mistakes, there are a couple of them. One, when you don't know about the process and you are doing it because everybody is doing. You want to wait till you have like 2 months to write before you study. The NCLEX actually is a test. It doesn't really test your intelligence, like how intelligent you are. It actually tests how you can act with what you know, with the knowledge that you know, how you can apply them. So they are going to give you a lot of scenarios, a lot of like clinical settings that you would need to apply what you have studied. And if you want to use about 2 months, you will find yourself wanting. So give yourself time. Don't do it in a rush. For the NCLEX, I say all the time that it is now easy to pass the NCLEX. So make sure you are not doing it alone. Get people who are coaching you, people who are learning. It's about knowing what everybody else knows. But if you don't get closer to people that knows, or are doing the NCLEX, how would you know what they know? Or for you to even start with it. So I think these are the few mistakes that.
So all that Tilly is saying in summary is that research, get your information right, know the process before you start it. Because if you don't know it, it's going to prolong things. You're going to spend more as well. Tilly's life has paused.
Oh, she's here. Forgive her.
Okay, so yes, Tilly, you've helped a lot of people. Can you share a success story of someone you helped who passed at first, attempt?
Oh, there are lots of them. One is Nesara. I just saw her message, so let me just say, one is Nesara. She just sent me a message. So Nesara actually started last year. Yeah, and she's one person that she's even part of our consorts now.
Wow.
Yeah, a very down-to-earth person. I've met her in person, and I really loved her. I loved everything about her. Yeah, so as you know, one thing about the NCLEX I say is that don't. As I said, it can be frustrating. Okay, from the beginning, it might be frustrating. You might think that, let's say I need to do this, I need to do that, but just stay calm because the NCLEX itself, it will test your level of your patience. Even on the NCLEX, even that day that you are writing, it will test you. But one thing I would say about Nesara is that Nesara was somebody that when I spoke to her from the beginning, she just relied on us. She just put all her on us. So when you tell her, Nesara, let's do this, it's time to do this, If she's not having the means, she will tell you, oh, okay, so give me time. Then she will report to you.
Okay.
And it was so smooth with her. We have a lot of them. Linda is even part of our cohort. She too, she was with us and she passed.
And they all passed at
on
first
her
attempt.
first-
Wow.
Exactly. So for the NCLEX now, it's very easy to pass. Just that, as I said, don't do it in isolation. Don't think that, oh, let me go and write and come and prove a point to somebody. When it's you it might not go well
It
for
might
you.
not go. Okay, you spend more. So SCF is saying how many questions is the NCLEX test?
Okay, so with the NCLEX, since it is computer adaptive, like a cat, it's not having any specific number. So the minimum is 85. The highest the highest you can go is 150. The minimum you can do is 85 questions. And within that range, you can cut at any number. And then the computer will determine whether you have passed or you have failed.
So it's a pass or fail, because I can see somebody's asking, is it a band score too, just like IELTS band and all of that? So you are answering the question, and when the computer sees that you've passed, it just tells you pass. It stops you. Then you are done.
So the minimum is the 85. So at the 85, it means that you passed or failed with the minimum number of questions. So let's say when you are answering, you start with the question 1. Then it was like what should I even say? Like it will be marking you. So if you are going high, it will be giving you the high questions, like since you are still in the game. When you get to 85, if the computer will see that, oh, okay, so she is still in the game, but she has not reached the mark for pass, then it will continue.
It will keep giving you a chance.
Assuming you got to the question 85, and the computer was like, even if you get more questions, it's not going to perform well. Then it will just shut you down, and then you have failed.
So if you get to 85 and the computer thinks you've passed already, then it can also pass, right?
Yes.
Oh, okay.
If it thinks also failed, and irrespective of the number of questions they give you, and you can't pass, it will also cut you at the 85.
Okay.
And the same applies to any other number. So it goes like that too. We get to the 180, 150. Yeah.
That's in here. Who do we have here? Did I miss that question? But Batel is saying, if you have diploma in midwifery and already in US, do you still need IELTS?
It depends on so it depends on the visa that you want. You are on in the US at the moment. So if you are on, let's say, a family visa, you wouldn't need the visa screen, so you wouldn't need
the IELTS.
Yes, but if let's say you are just a student, you might need the IELTS because you would need to switch to another. That's an employment-based visa. Yeah.
So if somebody is watching today and wants to start, what is the very first step they should take tomorrow? They want to start tomorrow. What's the first thing they have to do?
Okay, so first step, just contact us. When you contact us, we will give you our website link for you to apply. You need to sign up to us at a service charge fee. So if you join the TikTok Live, just mention the EOG 2025 for your promo discount. Then once you make the payment for the service charge, then you will be granted access to our website to provide your information for us. When you get the information, then we are starting for you.
Wonderful. Yeah. And can anybody from all over the world contact you, or you are just for Ghana?
Yeah, so everyone if once you are a nurse and you want to go through the NCLEX process, why not?
They should contact you. Wonderful. So guys, please contact NCLEX Pro Solutions with the discount code JOJ2025 to get your $5 discount, and they are going to help you. If Sally says, so how will you know if you have passed? Since you said if you pass or fail, it will stop. They'll give you the information. They'll just tell you you've passed or you failed. Am I lying?
Oh, okay. So with the pass or fail, when it cuts like that, some of the boards would send you message after some hours. For example, Montana is just 30 minutes. So they will send you an email or your line saying that you have passed or you have failed. And Colorado Board of Nursing will take like, let's say 1 to 6, like about 5 hours.
Wow.
After the end, they had to tell you that you have passed or you have failed. But if you want to know officially whether you have passed or you have failed from the NCSBM, you can check on their website within 48 hours.
48 hours, within 2 days. Okay. If yes, Sally, I think this question Tilly has just answered. Will you get the results immediately after the exam? So that's what she's just explained to you. You're welcome if you're Sally. Guys, if you joined in, you just joined in. Today we've talked about the NCLEX process made easy for nurses, midwives, public health nurses, psychiatry nurses. And I have here with me in the guest seat Tilly Young, who is an NCLEX consultant from NCLEX Pro Solutions. And they do help people to go through the process of getting their NCLEX done and all of that. And they are running a route which makes you get to write your NCLEX as quickly as possible. And it's so super affordable. It is super affordable. So please get in touch with them. If you join this live session, get in touch with them with the short code, the discount code JOJ2025. NCLEX Pro Solution, can you please pop the discount code in the comment section again for us? And you are going to get a discount, a $5 discount with a fee that they are going to take from you to help you through. So do well to get in touch with them. NCLEX Pro Solution or Tilly, give a summary of the promo, what you are doing as a closing remark before we leave today.
Okay, so with the promo, since you joined and you are coming from our precious host, yes, that's why you are having the promo code. So please take notice of the promo code JOG2025, and when you contact us, just tell us that, just give us the code. We will be glad to assist you through the process. Yes, and very soon we will be launching our tuition, which is going to be very effective and very efficient. And our aim will be to produce, a pass mark of 100%. It means overnight episode failure, you're not going to fail.
You will not allow them to fail. It's not possible.
Yes, so that's what you're going to do. So thank you very much, our hosts. I'm very much appreciative. Thank you.
That's wonderful. When are you launching the tuition?
Very soon.
Okay.
I can't give a timeline, but very soon.
When you guys launch it, you can come talk about it as well to let people know what you are doing.
Thank you very much.
It was great having you here. Guys, if you've got any questions, you can, it's $5 discount, Battelle. If you've got any questions, please, let's give Tilly 2 minutes. She has to go. Please pop your questions in the comment section or request to join the guest seat now because Tilly is going to go now. And then, are we having NCLEX Pro Solutions still on in case somebody has got a question?
NCLEX Pro Solution will still be here for any other questions. So please,
you can. You can.
And NCLEX Pro Solution will be here. Yes, please.
Wonderful.
Thank you very much.
Thank you too. It was great having you.
Everybody, thank you. Thank you.
Okay.
Patricia,
yeah, me too. Great. So guys, if you've got any question, for 15 minutes is even a lot. I also have to go now. So guys, if you've got any questions, please quickly pop it in the comment section. Anna, that's wonderful. You're welcome. Pop your questions in the comment section quickly and let's talk about it. Or if you want to join the guest seat, request to join the guest seat and we will go. We'll be leaving in a bit. Okay, let's see if we've got any question on YouTube. Okay, so guys, the replay of the live session is going to be available on my YouTube channel. Channel name is Josephine Greatness TV, just as you see on the top there, my TikTok name. When you go on YouTube, type Josephine Greatness TV, or you can find the link to my YouTube channel in my TikTok bio. Click on it and it will take you straight there. You find the replay in the live session, in the live portfolio, or it will be available on the playlist relocation or immigration. Miss Celsi says, I have diploma in midwifery and BSc perioperative nursing. Do I qualify for NCLEX? NCLEX Pro Solutions. Can you please give an answer to that?
Charlie, question didn't come your boss, but anyway, so if you have a diploma in midwifery, do you have a perioperative? I don't think you will be. Still, they will see you as someone applying as a diploma in midwifery.
In midwifery, yes.
Your perioperative is specializing in one area, which is perioperative nursing, and if it was a degree midwife, it would have been better. But you specializing in a particular field will make it more difficult.
So you, I think from all that we've gone through today, the midwifery will be better than the perioperative. But then, if it's a degree in midwifery, it's easier. It's easier. So was it Sally, Miss Celsi? Please watch the replay. I was here with a diploma midwife who went through the process. You need to watch that replay. It will help you a lot. Okay. And if you have any plans of upgrading your midwifery certificate to degree, that too will be great. And this user is saying, will the exam be written in US?
Definitely, it depends on where you are. If you are in the UK, you write it in London. If you are in US, you have a lot of places to write it. And if you are in Africa, you only have Kenya and South Africa or India.
Okay. Wonderful. So this person is saying, Angel says, I'm currently doing BSc in general nursing. Perfect. Amazing. When you are done with it, get in touch with NCLEX Pro Solutions and they will take you from there. Okay. Any other questions? We've got. Guys, if you've got any questions, please pop it in the comment section. We've got just 2 minutes to go. I'm going to end it on YouTube now. If you just joined in, you are welcome. But unfortunately, we are ending the live session. Today, we talked about how you can get the NCLEX exam written in a quicker and easier process. And I had here with me NCLEX Pro Solutions. And one of their consultants, Tilly, was here with me as a guest. And so if you just joined in, don't worry. Don't feel you are too late, because the replay will be available right after this live session on this same channel, Josephine Greatness TV. So do well to watch the replay. It will help you a lot. I will say that I was here on a live session with a diploma midwife who went through the process and is currently licensed with US. So you should watch that replay as well together with this one, and it will help you. Once again, it's Josephine Greatness on Josephine Greatness TV. It was great having you here. Take care until we meet again in my next live session or my next video. Bye-bye. Okay.